Hi, I'm Dr. Margreet Wibbeling, midwife specialist and your host of the Birth and Baby show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms and midwives to have the best birthing and parenting experience through natural, physiological and intuitive care, resulting in birth and baby advice you can trust. Hi, we are back here with a wonderful episode with a lovely guest, and her name is Marion Littlejohn. She is, I think, the most experienced independent midwife currently still practicing in the country, and I don't know, she must be somewhere on that same rank in the world. She's wonderful. She's got such a vast experience and wealth of knowledge to tap into. So I'm very honored to have her today. This episode is sponsored by Zinplex, one of the market leaders for more than 2 decades. Zinplex provides quality and affordable products, and it's trusted by moms and midwives alike. Visit zinplex.co.za and get your hands on these products. Zinplex, a healthier way of life. Hi, Marion.
Hi, Margreet. So nice to be with you.
Yeah,
thank you for inviting me to the show.
Yeah, and thank you for making yourself available. You've got so much wisdom that the world needs to know of. And today we're going to specifically focus on something that you are very passionate about, and that is really linked to perinatal psychology and mental health and preparedness. And it is also October is Mental Health Awareness Month, and mental health is so part and parcel of the whole story when it comes to pregnancy, even pre-pregnancy, but also birth and parenthood. So we're going to talk all about that today. But before we dive into the topic, tell us just a bit more about yourself and your work as an independent midwife.
I started practicing as an independent midwife in 1982. So that's about 40 years ago. However, I did stop and have children for a while and then pick up again and then stop and have another child and pick up again. So it was interspersed with my own personal experience. I learned from my clients. I also learned from my peers. And obviously I worked on and off in the hospitals and at the birth center. And I learned from my icons like Michelle Audin and Ina May Gaskin. And I also learned from people like Prof. Sheila Clow and I learned from my peers. I had 3 sons, birthed at home. My second one was born unassisted by choice, and he was 44 weeks 4 weeks overdue. So I was 44 weeks pregnant, and it was unheard of at the time. I then went on to study a psychology honors degree after some time, and I'm doing ongoing studies in infant mental health and what that means for future generations. So, yeah, it's a really interesting junction, you know, the midwifery or the maternal infant mental health connections, and really important as midwives, particularly to be able to provide, to facilitate a mother coming into her own and being born, as it were, herself, and being supported. And the midwife, if she's aware of things, can really be a key person in that journey for the mother. And obviously, if we support the mother, we're indirectly supporting the baby. And that's the ultimate aim, is to try and facilitate that each baby has a real connection with the mother and can therefore develop a real safe connection with the mother and can therefore develop safely. And we know from research that social development, mental development, or we call it cognitive development, emotional development, it takes place in the framework of a really connected mother-infant or caregiver-infant relationship, and that it's the relationship that provides the background. So that's what I'd like to talk a little bit about today.
Yeah, sure. No, and I can see that you're definitely passionate about it. And if did it started when you studied psychology, or was that a reason why you went into studying psychology because you picked something up? How did you get to this on this special interest?
Well, I think both. I think getting married and having children was the trigger for me because I
Hmm.
couldn't understand why uh, I behaved in the ways that I did and felt the ways that I did towards my child. You know, I had a lot of conflict, especially with my first child, and you know, it's one of the signs of a very depressed mother when she has um, very hostile feelings towards her infant, and
Hmm.
she's afraid of hurting her infant. She knows that those hostile feelings are not good for the baby, but
Hmm.
she can't help it. It's something that gets triggered inside her. So it was that experience really that pushed me into therapy and um,
Wow.
myself, and then triggered my whole interest in the birth field. So I went into the birth field having this awareness and feeling both for the baby and the mother.
Wow. So I think there's nothing as powerful as having first personal experience that drives why you are doing what you're doing. Marion, would you mind sharing a little bit from your own personal experience then? How did that process work? I mean, you shared that there was feelings that you recognized that were not right. And then how did you get to deal with those? Because I think that is where we're going to how moms can prepare themselves, right?
Well, I had a very good friend, so
Mm-hmm.
that's always a good place to start. Have
Yeah.
to have someone, if you don't have family, and you know, so much of what we feel or what our children trigger in us is about the way we were treated as children. You know, the way. Okay.
Mm-hmm.
The way our mothers were treated, and the way that was handed on to us. So, you know, if my mother was aggressive or violent or spoke or negatively towards me or shouted, then it affected me deeply. And then when I had my own children, I was triggered because the demands of a baby can trigger those primal patterns that are laid down very, very early in us as children. And it's a physiological response. You know, your heart rate goes up, you get angry feelings coming up from your stomach, and suddenly you want to roar at your child like a lion, and you're thinking, this isn't right. He's a baby, you know, and I must appear like a mad woman to him. So you know, I was very isolated as well. So as I said, to have a good friend
Mm-hmm.
is, I think, the first step. If not a friend, then a family member, a counselor, someone you can turn to when you experience this inner conflict and see yourself behaving badly and
Mm.
don't understand what your child needs or why your child is behaving like he or she is.
Yeah.
And then I went through a very intensive therapy process for a while, and it's kind of continued throughout my life. So I'm still working on my relationships with my children, and they are all over the age of 30.
Mm.
And I think that is another big positive, is that no matter how depressed you were or how bad you felt or how bad you feel about your behavior, if you can be self-reflective, if you can sit down and think about what happened to you as a child and do family constellations and see a therapist and feel what it was that you felt as a child when your parent was ugly to you,
Mm.
to feel that hurt and then to separate or make that distinction between your child's behavior and your own child within that is very demanding as well, because our children remain stuck if we remain stuck, and our children will remain stuck unless we can connect and love them and give them a voice and find a safe space for the child in us to express themselves. So that's what a therapist or a good friend does for us. And then we can go back to our child with renewed understanding and clarity, and we can withstand the child's feelings, because we all come into the world with strong feelings. They're just there. Feelings of love, feelings of need, feelings of wanting closeness, feelings of anger when our mothers don't comply with our wishes. You know, those feelings are all there. And I think the hardest thing for mothers to do is to allow the child to have their feelings and stay calm themselves.
Yeah, sure.
You know, and not shut the child down. You know, when the child is having a tantrum, especially if it's in public, you know, we're embarrassed. We think we're bad mothers. We think our child is behaving horribly. We don't understand the process. And so we shut them down. You know, we tell them to be quiet. We shout at them, or we grab them roughly and take them out of the shop, or we reprimand them when they're in the car. And it's difficult.
It
being
is.
A parent.
It really is. And I mean, it's difficult to be a parent anyway. And then also if you realize, hey, I've got quite a bit of baggage that is all coming out now, and then it gets all exemplified. Yes. So Marion, maybe for some people that are listening, they might identify like, I react maybe unnatural in that situation. It's a trigger from my past, or things that I need to deal with. It's not just the normal overwhelmingness of the change and being a parent. So how can pregnant couples prepare themselves just that they can create the right condition to be in a good mental space before their parenting journey and also for their birth? Are there any things that they can work and get them in the right space of mind already, or is it just like, let's see what happens?
Are we pushed for time, or can I elaborate a little bit?
You can elaborate a little bit.
So I'd just like to talk a little bit about the infant mental health, because knowledge informs us, and very often that can take us to a place of deeper understanding both of ourselves and of the child. But I'd just like to talk about the baby as the baby's coming in. So infant mental health is largely dependent on the primary caregivers. That's the mothers and the fathers and other people in childcare staff or grannies, somebody who is going to look after the child fairly consistently. And it refers to the capacity of the baby or the infant to form close relationships, to develop and be able to explore the environment and learn. So there are two different types of attachment that have been identified. The one is secure attachment. And, you know, I just want parents to distinguish and midwives and professionals to distinguish that the baby forms the attachment. The mother has bonds, social bonds with the baby. But she formed attachments to her mother. So the social bonds that she develops with the baby will be informed by her attachment to her parents. But attachment is a biological need for closeness. So it's actually driven by the body. It's instinctual. And so the baby seeks this proximity and this safe place so that he can develop and grow. And as I said, there are two main types. The one is secure. So the parent will provide that secure space. And if you watch animals in nature, and a lot of this theory, which has been very deeply researched, is based on ethology, or the study of animals. You know, the first few days and weeks of the puppy's life, or the kitten's life, or the foal's life, or the cat, the lioness's life, the lioness pup's life, she will stay close to them, and they will seek out that. They will crawl towards her. That's where the breast crawl emanates from. They will seek the nipple and the breast. They will want that warmth and that closeness. And then when they're satisfied, they will relax and they'll sleep most of the time. And the mother will stay with them for as long as she thinks she is biologically designed to. So for a lioness or a cat, it's maybe 3 weeks, and then she starts to venture more and more out, further out, away from the nest, and the pups have to learn to adapt and spend less time, and eventually they follow her, and eventually they sort out their own food needs, and then she gives them less and less breast milk. So it's a process. And if she doesn't provide that secure base, if she rejects them at birth, they're going to die. If she's aggressive towards them, if she is absent, withholds from them. So in the case of a cat, let's say a lioness, if she gets murdered by other animals while she's out on the prowl looking for food and doesn't come back to the nest, those pups are really going to have a hard time learning how to be in the wild, because she's not going to be able to show them. They won't. Their secure base is gone. So it can happen in various ways. And then the secure base, the insecure base. So children they learn, but they learn in different ways. And if we're going to create a better world and have better relationships with each other, so that we can prevent wars, and we can find solutions to our problems by talking to each other, then, you know, we've got to look at how the relationships start and how we provide that secure base, and how important that loving relationship is for the child to be able to continue having loving relationships with the parents and outside of the family. And there are a couple of types of insecure attachment. So they've discovered through the research avoidant attachment, which is where the mother may just avoid the infant, or the infant will avoid the mother. And they tested this in something called the strange situation test. So the mother leaves the room and then comes back into the room, and a child that's securely attached will cry a little bit, will come to mummy, will be comforted by mummy, and then will continue to play. That's a secure attachment. So crying when she leaves the room is a good sign. The avoidant infant will barely notice if mum leaves the room, won't reconnect with her when mum comes back, and may be very distressed, show signs of distress while he's playing. So he's not playing effectively or not playing deeply. There's the ambivalent attachment, which is hot and cold. You know, sometimes it's really good and sometimes it's terrible. And so that's an ambivalent relationship. And then the disorganized attachment, And, you know, that it's quite a difficult one because it's linked to a very severely depressed mum, or a mum who's had terrible trauma, maybe drug addiction, and so on and so on. And the baby, because babies know us better than anyone else, so the baby has to find a strategy for survival. And if he deems his mother to be not safe, he's going to find even if it's a disorganized strategy, he's going to have to rely on that to survive. And so a disorganized mother is going to be just that with her child. She's not consistent. She can't communicate consistently with the infant. And it's little things like changing the nappy. You know, how many times do we change a nappy every day? You know, at least 8. And how do you change that nappy? Are you rough? Are you cross? Are you short? Is it cold? Do you wipe the bottom roughly? Are you gentle? And those patterns eventually become part of the infant's repertoire. So how the mother does that on a daily basis and how consistently she does it is really important. So if she's depressed and she's really struggling and she's been up all night and she's like, oh no, he wants me yet again, you know, that's a cause for concern. It is, how do we support that mother? And how does she find strategies to support herself in the situation? So that's the basics of attachment theory, basically, that is transgenerational. It's transmitted from generation to generation. And I really looked at my family and the patterns of attachment, you know, with my grandmother and my mother, and my grandmother and her mother on the maternal side. My grandmother was I think she was born at 28 weeks, and she was put in a shoebox and fed with a dropper and kept in the kitchen near the stove, and didn't have a relationship with her mother, barely. Wow. She was looked after by the housekeeper, and the housekeeper was quite a busy woman. I think she obviously was very consistent because my grandmother survived at 28 weeks in I think she was born, when was she born? 1927?
Wow.
Yeah. No, maybe before that, 1914, somewhere there. Anyway, you know, surviving as a baby was dicey at the best of times, never mind if you were born at 28 weeks, but she did. And definitely disorganized attachment to her mother and avoidant. So that when she had her own child, who happened to be my mother, that some of that patterns of some of those patterns of attachment were handed on. And, you know, I think my role has been, first of all, to try and heal myself, which is an ongoing process because we have to develop as well. I mean, we go through all the stages of development from child, adult, old person, and so on. And we still have to try and heal ourselves in those processes and turn around and say, actually, I don't want this to continue. I don't want this pattern of attachment to continue. I want to do better. I want to learn to try and give more than I received, which is really hard. Really, really hard. So I think looking at families and midwives, let's just start with midwives. I think that midwives can do a huge amount if they know about attachment theory, if they know what the implications of what their role is, it's phenomenal. So even if they just ask a question, sometimes they will come in and I've had models, beautiful young ladies walking into my room, and I think, wow, she's chosen me as a midwife, and then I will ask a simple question like, how's your relationship with your mother? And within 2 minutes, she's crying and she's sharing her load. So what you see on the surface of a person is shallow. And once you invite, so it's to provide that safe space for them, just like we need safe space as infants, to provide a safe space for that mother who is, maybe the partner's left her, maybe her mother's angry because she's a teenager and she's pregnant, maybe she is a drug addict, whatever the trauma is, and drug addiction is trauma based, is to offer a platform, a safe place where she can release some of the trauma that she feels.
Yeah.
And then just be a reflection, be a steady point. So, they've done research on mothers and attachment, and mothers who have problems with attachment are the same mothers who don't arrive for their antenatal appointments. They are the same mothers who default on their visits.
Yeah.
So you won't see them for 2 months. And then when they come back to you, it's drama, and I'm not talking about trauma. Trauma as in historical drama. I'm talking about very often there's problems with the pregnancy. And then you're picking up the pieces. So good antenatal care from the midwives and referral where necessary. If that mother, her story and her behavior makes you feel overwhelmed as a midwife, that's a red flag. When she's gone, you sit down and you get your list of support systems out, and the next time she comes back, and you phone her to make sure that she comes for her antenatal appointment. And then you chat to her and you say, look, I really think I'd like to offer you some more support. And I know how difficult your situation is. So you're not palming her off.
Yeah.
But you're building a network that will offer her a safe place. Because very often with a disorganized, a mother who has a disorganized attachment, she won't remain with one person. She goes here and she goes there and she goes to that one, and then she disappears for a month, and then she comes back because that one was cross with her to you, and you might be nice this time. And so that's the kind of pattern, and you want to try and enfold her in a network of support and help if she is able to reach out. So that's in really severe cases, but most of us we have moderate. We all have some trauma. That's part of growing. Frustration is necessary for our development, but we still need to talk about it. And I think that connecting with the baby, so helping the mother connect with the baby. And I have taught midwives in groups and mothers in my classes to do a meditation or several meditations and find ways to connect with the baby, to talk to the baby, to play with the baby before the baby's born, and if necessary, therapy, because sometimes a mother may not want to be pregnant. And so there's two people there. There's a baby and there's a mother in the same body. And how do you facilitate them connecting? So my experience is this, that if there's a really, really happy mother. She wants to be pregnant. She's married. Her husband is a lovely man. He's supportive. Her mother's supportive. Her parents are on board. She's stable. She has a home that she can call her own, a place to be. Then the likelihood of that pregnancy being healthy and that mother giving birth in a very loving, gentle way is high.
Yeah.
That's what you're aiming for.
Mm-hmm.
Because you want everyone to have a gentle birth. But in my practice, I've found that if the mother's got a lot of trauma, it's more difficult for her to have a gentle birth. And so it's harder work for the midwife and harder work for the support groups who care for her. And then offering classes. So, you can't, people need little bits of information at a time. And you can't always bombard them with a lot of information. So I recommend classes, but not just education. They need to be experiential. So antenatal classes need to facilitate parent-infant bonding, facilitate communication in the relationship with the other parent, and do physical exercises like the hypnobirthing techniques, breathing exercises, meditation, focused awareness, and so on, so that the mother can practice. Because that's how I started. I knew that I wanted to be different, and I read some books and I started practicing what the book said, and it felt all wrong, but I did it anyway. And that's how I learned. So it's the same principle. You can do the therapy on the one side, but on the other side, you've got to actually practice how to be. And then when it triggers feelings, you go back to therapy and you cry a little bit and you get angry or you talk, and then you come out of that feeling a bit better, and then you practice some more, and eventually you change your behavior. I'm just looking for anything else I might have missed. So I think, the biggest task, there's some more here. So turn the page. So form support groups for mothers, antenatal support groups. The birth center that I am running here is in a low socioeconomic area. So it's not a Constantia. It's more like Grassy Park. And so, people can't afford to pay for classes. They measure their antenatal visits very carefully because they don't have funds. But they don't want to go to government hospital because that's more traumatic for them, and the government hospital is overburdened as it is. So forming support groups and finding a mother and educating her, training her so that she can then form a satellite group in her community, and then you support her. Give mothers a chance to talk, ask questions. And then the birth is not just a physiological event, it's also an emotional event and will affect the bonding and the attachment process of the baby. So a mother who has a very traumatic birth for whatever reason is going to need to process that trauma, and processing that trauma will help her attach, or help her baby to attach and her to bond and to resolve some of the trauma. And obviously a gentle birth for the baby is a wonderful thing, because the baby is an autonomous being in the mother's body. So, I started out midwifery. I trained at Tygerberg Hospital. All the mothers were on their backs. They had groendoeke. You couldn't even see the mother's face. There were so many groendoeke. By groendoeke, I mean the sterile green cloth that we used to put over the legs and the tummy and under the chin so that you could just see her mouth and around the opening where the baby was going to appear. And then you instructed her how to push. And again, I'm coming back to infant mental health. In a healthy mother and a healthy fetus, the baby is active. So if the mother's in labor, the baby can be active all the way through the labor. The mother will feel the baby kicking just before she's about to push the baby out. Yeah. And then I'll say, yes, the baby's helping you. And I attended a birth the other day, and it was a water birth, and there was a little bit of shoulder dystocia. And I actually had one hand underneath the mother and one hand on her tummy because I wanted to feel the position of the baby in the womb. And my other hand was under the water on the baby's head, waiting to see what I could do to help the baby. And then the baby gave this massive kick and a push in the womb, and I could feel it with the one hand. And then I was able to dislodge the shoulder and the baby was born. But that was incredible because the baby was so active in the process in helping herself be born.
Amazing, hey?
So baby comes out and thinks she's done it. You know, she's done this amazing thing and she's going to be able to do this forever. You know, she's going to be able to navigate her way through life because she's empowered. And then she comes to the mother and she comes to the breast and she activates all those processes. And it's the mother who responds. So the mother doesn't activate those processes. The mother's process during birth is involuntary. And the less trauma she is carrying, the more she can surrender into that involuntary behavior and allow her healthy baby to push himself out or herself out and to participate in the process. That is a healthy situation. And I'm not talking about complications. That's another whole issue. And that's for another seminar. But but the complications, are there, and a midwife's job is always to be on the alert for both and to assist where she needs to if things are, if the baby and the mother are not behaving in the way that they should be in a healthy labor and birth. Yeah. And then obviously afterwards, encourage skin-to-skin care, encourage breastfeeding, how to support breastfeeding, and doulas. Let's not forget to talk about doulas. You know, I run a very busy practice. I don't work without a doula, at the current time, and where I can't care for or see or have the space or the time to be with the mother, the doula often can.
Yeah, exactly.
And it just makes a world of difference.
Absolutely. Sure, Marion, you said a lot of things. I'm not even going to try to recap it. I'm sure everyone will take something out that they need to hear for themselves and that they will link to what you've been saying. But I think the bottom line for today's talk is to really be aware of how, as humans and even as animals, we are... how our mental state and our physical, it's all interlinked, and how important it is to not ever forget that aspect. Whether you are a mom that's realizing, hey, I've got traumas from my past, or just by naturally leaning into the attachment with your baby, how important that is. And also even as healthcare workers, how important it is that we are even connected with ourselves and our past, because I think if we've gone through healing ourselves, we can also be better healthcare professionals in facilitating to others. So yeah, it's just very good to have awareness of all the dynamics with, dealing with trauma and how we react in real life, and how important it is, how it filters back to infant health. So I'm sure there's so many things we can unpack from your talk, but time is limited. I think you've said the most. You've said how we can deal with it, how we can identify it, and how we can facilitate good processes for women to learn to talk and to provide better attachment and so forth. So I just want to thank you for sharing all this wisdom. Is there anything from your side, lastly, that you want to say, or you're welcome to also put a word out there on your birth center where people can find you if they want to come and birth in your facility? The show is yours.
Thank you. I do have an attachment, maybe one or two attachments that I'll send to you, and you can add them or link them when the show is aired.
I would appreciate that. Yes.
Yeah, and I just want to say thank you for this opportunity. I really have enjoyed your company and your hosting and listening, and I've enjoyed sharing this information, which, as you say, is quite close to my heart. And I have a website, spiritualbirth.net, and if people want to talk to me or have a Zoom session, just let me know. You can contact me through the website, or you can phone me on my cell phone number, which you can get from Margriet. And thank you again. Thank you very, very much.
Wonderful. Thank you, Marion. So her website is spiritualbirth.net. That's where you can find her, and you can reach out to us if you want her contact details. So that was us for today, a very important topic. I'm sure you felt enriched and hopefully empowered by it all. We'll see you next time. Thank you so much for joining us today. If you found this episode helpful, please leave us a review or give us a rating, as that really helps us to get the show out to more people. And don't forget to subscribe. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. And remember, you're making a big difference because you are shaping the future of humankind. Thanks for listening, and I look forward to journeying with you. Breastfeeding is one of the amazing life experiences a woman and a baby can share, but it's not always easy. The truth is that breastfeeding is a skill, and like any other skill, you need to learn, practice, and be supported in order for it to become second nature. Sister Lillian Center Essential Breastfeeding course will teach you everything you need to know about nursing and how to love your breastfeeding days. Click the link in the show notes or visit sisterlillian.co.za/breastfeeding course to find out more about this invaluable course. And if you're enjoying the content, remember to share this with a fellow mommy or friend.